Welcome to the Fairwinds Medical Podcast, Healthcare Unscripted. I'm Dr. Chris Leslie, orthopedic surgeon, and I'm honored to have a guest today, Dr. Ben Carr, a fellowship-trained spine surgeon from Johns Hopkins, with us today. He has a great story. So, Dr. Carr, I'm a relatively informal guy. I think let's go with Ben and Chris, and let's go from here. You were in practice for about 12 years or so, and then had some health issues that took you on a different path. So, if you wouldn't mind, if you kind of expand on that story, because it's a great story.
Yeah, it's good to talk to you, Chris. Thank you so much for the introduction. Life is very rarely a straight line, as I'm sure you know from your experiences in practice and life in general. And certainly that's the case for myself. As you mentioned, I am a fellowship-trained spine surgeon. I did my undergraduate at Roger Williams University in Bristol, Rhode Island. I'm from Providence, Rhode Island originally. Did my medical school at Vanderbilt University School of Medicine, and then did my orthopedic surgery residency at Johns Hopkins University in Baltimore, Maryland, and subsequently did a year of reconstructive spine surgery at Harbor Hospital in Baltimore as well. And then, as you mentioned, I was in practice for approximately 12 years total. The first 3 years I was at Harbor Hospital, which is affiliated with MedStar. And then the next 9 years I was in private practice in the surrounding areas of Baltimore, basically Baltimore County, as we would call it. And then what happened was I finished my training in 2005 with the fellowship, and then was in practice, as mentioned. And then I started with a new practice approximately 2007. And shortly thereafter, I was diagnosed in early 2008 with multiple myeloma, which, as you can imagine, some people may know is basically a bone-marrow based cancer that has various manifestations. For myself,
Tell the story about how you discovered this when you were trying to race your son, I believe it was.
Yeah, so I guess the easy story, part of the story would be is as a 34-year-old young man, I thought I could easily beat my 5-year-old, as I had done for many years. Basically, what happened was the longer part of the story was that we took him up to visit my parents. I reached into the overhead compartment of the airplane, and I felt a pop in my left hip. I said, "Oh, I'm just getting old, the pain." That was exactly. That was August, and then I tried to race my son, if you will, probably at the end of August, and I felt this extreme pain in my hip, and where previously I could give him a 20-yard head start and beat him, I couldn't beat him. And so I limped around like the typical, I say headstrong, perhaps stubborn is the right word.
Well, you don't make it in this business if you're not headstrong.
That's exactly right. So I limped around basically from the end of August until November, and then I was actually at a Thanksgiving, the time of the season we are now, is Thanksgiving dinner. And one of my relatives at the time, who was a nurse, she said, "Are you limping?" And I had been hiding it. I said, "Yeah, I am limping." And so as it turned out, I said, "Well, I got to get checked out." And then I actually got a little bit of a little upper respiratory infection and started coughing over the next couple of weeks. And every time I coughed, I had excruciating pain in my left groin. So, of course, I thought I had a hernia. I went to see one of my partners at the time, really good guy who I really trusted, still friends with today. And he said, "Yeah, you are a little weak in that left hip. You probably do have a hernia." I said, "Yeah, you know what? You're my partner. I'll go see one of my older partners at my first practice." I'll give a little shout out to Dr. Leanne Curl, who's actually one of the Baltimore Ravens physicians.
Wow.
And I went and saw her, and she said, "Wow, you are weak. You're limping." So, just for, the sake of argument, let's get an MRI just to make sure. But I agree. I think it's probably a hernia, she said. So get the MRI ordered. Of course, in my head, I was going to take over spine surgery in Baltimore County. And I had a executive physician meeting on a Monday evening. So I get the MRI scheduled before. And as they take the MRI and they gave me, this is old school for all the young people watching. They actually gave me physical copies of the films. And as I'm walking out the door, curiosity killed the cat. I held up the films as I'm walking out the door. And there I see this grapefruit-sized tumor in my pelvis. And I was like, for lack of a better phrase, I watched my language. I said, F me. Of course, the bone doctor has a bone tumor.
Of course.
And,
Of course.
I didn't know what type of tumor it was, obviously, but everything started to make sense at that point. Sort of the background was I had just joined my new practice about 5 months before. My daughter, who's now a freshman in college, was in utero. My son, who's now a college graduate, fully employed engineer, was, like I said, 5.5 years old, and I just bought my McMansion, and was doing all my lawn tending, and so no, it wasn't just getting old; it was actually something else. So that was the beginning, and I won't drag on too long, but that was the beginning of a approximately 4-year sojourn, as they say, trying to sort out what I was going to do with the rest of my life. And I laugh because, that was 17 plus years ago, without giving my age away. That is actually now 1/3 of my life. And at the time, I had no idea if I had another month, if I had another year. All I knew was I had a almost 6-year-old, and I had a baby on the way. I had a spouse. I had commitments. I had a new practice. And, where do you go from there?
Well, you developed a peripheral neuropathy, so it made it impossible for you to stand at an OR table, especially as a spine surgeon, for 2, 3, 4 hours.
Yeah, the spine surgeon who can't feel their hands very well traditionally doesn't do very well in practice. So I battled, as you can imagine, for a while.
Of course.
Some treatments here and there, but the short version of the story is that approximately 6 years after my diagnosis, I had a recurrence and underwent new chemotherapy, and then subsequently underwent a bone marrow transplant with my own stem cells. Now that's actually 10 years ago, 2015. And then the sort of residual effects of that after the bone marrow transplant was, as you mentioned, I had numbness and tingling in my hands. But even more importantly, as people would know and who have experience in science or medicine, I lost my sense of proprioception. In other words, I couldn't tell where my hands were in space. So buttoning buttons, tying ties. If I wasn't looking at what I was doing, I couldn't really tell what was going on. And so to that end, the easiest example I would give a sort of non-medical person is if I'm putting utensils away, say, into the drawer, if I don't look at the utensil, I will drop it. And so a lot of, as you know from your practice, a lot of surgery is the sense of feel, the sense, the muscle memory of the touch. And
Absolutely.
so I really had lost that. And so, there's the primum non nocere, first do no harm. One of the things that we take, part of our Hippocratic Oath, our promise to our patients that the first thing we'll do is not hurt them. And so what happened the sort of last, the last 6 months in practice was I was basically using about an extra 30% of my mental powers to overcompensate for what I was losing physically. And that was just not where I wanted to be. I'm very fortunate. I have a very close-knit family. I spoke with my father, who has always been one of my mentors, and I said, I'm going to have to step away.
That's hard.
Very
And
hard.
I just interject here. I mean, you spend your whole life training to do this. That's hard.
It was, and as you can imagine, at the time, you subtract 10 years from the ages of my children, and also too, at the time, I had stepchildren who were also very young. So I basically had a range of about, children from the ages of about 13 down to 5, and you have obligations, you have responsibilities. If you take the emotional aspect out of it, just trying to figure out how you're going to navigate, the next phase in your life when you've devoted so much, as well know. I had basically decided as a 15-year-old failed athlete that I would become an orthopedic surgeon, and here it was now, approximately 20 years later, and I would have to step away. But step away I did.
And, nothing but high praise for that, because it's so hard to do. Because, I mean, so much of your life and training is built up into this, and your sense of who you are and what you want to accomplish had to be excruciatingly difficult to step away. However, you did, because as you said at first, do no harm. And so then how did you transition into what you wanted to do next? Because I knew there were a couple of cautionary small steps, and then ultimately you transitioned into where you are now today.
Yeah, it was, like as we mentioned before, as every self-confident surgeon, physician, I was going to easily transition right from private practice to, a regional manager for a orthopedic device company. I was going to become a consultant. No such luck. I actually would like to give a lot of credit to some of my former sales reps, representatives, consultants that I had worked with. Always had a very good relationship. My joke has always been that once you make the holiday card list, we're friends for life. And so,
Right.
there was I had a very few close friends to this day who gave me some leads, gave me some help. I moved down the pathway of interviews pretty far, a few occasions. And ultimately, as I've leading to, I had one president of a division for a major company who said to me, he said, listen, I don't know what to make of you. I don't know if you're going to be the best hire we ever had or the biggest flame out we've ever had, but one way or the other, I'm intrigued. And so, as it turned out, it really came down to they were not willing to give me the opportunity to throw my hat in the ring. And I respect that because I had no sales experience. I had not been on that side of the table, as we say. But it was quite daunting. So as I mentioned, I left practice in basically spring of 2016 and was going down the pathway of interviewing for sales up until probably the fall of 2016 with no hits. And so I had some remote history in sales, retail. And so, the lights have to stay on. The kids still want to eat. You have to pay the bills. And so I certainly wasn't at a point where I was ready to make my bucket list. I was very fortunate. I did have a disability policy, which, kept the lights on and allowed me to not starve, if you will. But I went back and had to humble myself and worked, a real credit to the Target Corporation. I was working at Target. Dr. Carr is the manager of the fresh perishable food area. And then after I did that for about a year, and then after that, I worked for a local supermarket chain. I'll give credit to Wise, WEIS supermarkets. I appreciate them giving me the opportunity, and I did that for a little bit over a year. And then finally, in approximately almost 3 years later, in 2019, I was hired by a local distributor, and I'll give him credit, Mr. Ilya Nudelman, Nudelman, who's really an interesting, really talented individual, a gentleman who is a immigrant from Ukraine, was born in Ukraine. His family was there. They escaped after sort of the social upheaval at the time. And this is a gentleman who entrepreneurial paid part of his way through undergraduate education doing online poker, if you can believe that. That's the talent.
Wow. Wow.
That's the talent that this gentleman had. But the point of giving you the story is that he saw my application, and his had an aunt who was a nurse, but actually worked at one of the hospitals, my first hospital. And he said, "Do you know this guy? You know, Ben Carr, Dr. Carr." She said, "Oh yeah." She gave me a glowing review. And I give him the reason why I bring him up is because he gave me the opportunity, he gave me the chance to start in sales, where the big companies who I'd used, some of the companies I'd actually used in practice, they were not willing to give me that chance, as I mentioned. But this entrepreneurial gentleman saw the bigger picture and wasn't worried about the resume, wasn't worried. He just said, "This is a guy who I think will add value to my organization, as big or small as it is." And so I will always be forever indebted to him for giving me that chance. And so I started in 2019 in sales and worked with that organization for about 3 years. And then once again, one of the gentlemen who had been one of my sales representatives, him fresh out of college, who had risen up to the level of regional manager for DePuy Synthes joint replacement, took me on as one of his sales representatives. And so I've been with DePuy Synthes in some either direct employee, indirect employee for the past 3.5 years. I'm also very appreciative to Mr. Andrew Reinhardt, my current distributor, former regional manager, for giving me the opportunity and knowing who I was as a surgeon, the kind of person I was, personality I had, that I could follow directions. I could fall in line. I understand, the food chain, and certainly able to humble myself and be part of a team. And so I think that, as you mentioned, you don't get to where you and I have gotten to without understanding chain of command, not in the military sense, but in the respect sense. And that's really what I got from my family, the way I was brought up by my parents. You respect those above you. You respect all people, really. But you certainly, it doesn't matter your title, you respect the people that you work with, and you try to learn and grow with them.
So, the interesting thing, all of that's fascinating to me, actually. But I think the interesting thing as an orthopedic surgeon, as you know, when you're in the OR, typically it's just you. Nobody else really knows what it is that you're trying to accomplish here. But to have you in the OR with me, with your credentials and your experience, would be first, obviously, it's instant credibility. But also, secondly, I've got another person in the OR who understands what we're trying to accomplish here. And that's a huge plus. I mean, your surgeons have to be thrilled to have you there because they know that you know what it is that you're trying to do.
Yeah, that's a great point, Chris. And always, from my perspective, when I was on the surgeon side of the table, there was the reps or the consultants that I really appreciated the most were the ones who were, if not empathetic, because certainly if they're not surgeons, they wouldn't be empathetic, but sympathetic to what was going on in my head, what was going on in my heart, what was going on in my stomach. And so, as I have transitioned to the consultant sales side of things, I use the old expression, the old E.F. Hutton. When Ben speaks, it's for a reason. I don't just speak. I don't speak just to tell you trivial things. If I say, "Hey, have you thought about this?" that means you need to look at that. If I tell you, "Hey, are we gonna be able to fit that?" that means you're not going to be able to fit that, and I know you're not.
And you also, when you see the sweat pop out of my brow, you know what it means.
Oh yeah, I used to routinely, as I'm sure I would, on my surgical days, I used to measure and weigh myself. I would lose anywhere between 5 to 10 pounds over the course of the day from sweat.
Sure.
And a joke I always had with the very first surgery I did as a in practice, I never forget it. As I was walking to see the patient, I got nauseated from nerves. And my father, who, he called me that night. He said, "How did it go?" I was like, "Well, I almost vomited. I was sick." He laughed. We laughed. And then, about 6 months later, he said, "How's it going?" I said, "Well, I don't feel like I'm going to vomit anymore." So, those small
Yeah.
victories. And so when I see the surgeons, no matter their experience level, I do understand that you are the captain of the ship, and all the pressure's on you. And so I try to become a calming force, a supportive force for them, so that if they're bouncing ideas, if they have a question, as you mentioned, I've been there. I get it, especially for the younger ones, because as you remember, if you take your practice in stages, there's what they say, it's when you don't know what you don't know, and then you know what you don't know. So
Right.
those surgeons who are in the phase of they don't know what they don't know, they need the most help.
100% true. Absolutely true. I mean, that's a remarkable story. And, as I said, I would be thrilled to have you in my OR, because there's something very comforting about having somebody else know um, the steps and what we're trying to accomplish and how to get there. And when I run into a roadblock, somebody that's got some experience to say, "Hey, let's try this."
Sure, and that's what I try to provide. We always talk about what's the value proposition, what value are you adding, whatever role you're in. And so I think that my value, I joke on my LinkedIn page. It says, your favorite surgeon's favorite sales consultant, because, I try to be the guy, the person who understands, who is almost commiserating, especially when times get tough. As you know, we all go through those times when you wish you weren't the captain of the ship.
Oh, yeah. Yeah.
And so when I see the surgeons in those situations, that's when I try to, or if they've solved the problem, you say, "Hey, listen, that was a big save. That was a great move, a great decision." Because when you're there by yourself, you are questioning yourself. You say, "How did I get myself here?" Well, you might have got yourself there just by pure bad luck. And so I think that that's where, being there, I certainly respect all my surgeons because I understand how much it takes to be there. And also by the same token, as humans, I mean, we're just trying to help people. I think that all of us got into medicine. You could have gone into any other field, but you wanted to help people.
True. Absolutely true. And especially when you get into the trauma aspect, you never know what you're going to find. I mean, you think it's going to be straightforward, but it often is not. And so to have somebody with some experience there that can help walk you through that, they've seen this, they've done this, that's invaluable. So how have you found the transition into being you're a distributor now? And so how have you found that to be?
Yeah, it's very interesting. I guess America, any type of free market enterprise, it's always best to be your own boss. You always enjoy being your own boss. I'm sure certainly for you, having been in practice for many years, you always feel best when you really have the most control. When you can direct the care, you can direct the services in the way that you see fit. And so I've been in different situations. I've been a direct employee. I've been an independent distributor. The part that I enjoyed the best, and certainly since I've had the opportunity to join Fairwinds Medical, I certainly want to give them their due. Being able to be invested and engaged to deliver the services, the care, in the most expeditious and streamlined way with a high level of quality is
True.
huge.
Yeah, I agree.
When you're part of the machine, you enjoy the support of the machine, but when you know that you're driving the process, there's nothing better than that. So, answer your question more directly, as a distributor, it's really nice to be able to pick and choose the products that you represent, the products that you put behind your name. I know for yourself, I'm sure your patients, your colleagues, they know what you've represented for all the years you've been in practice. And so the nice thing for me, as we mentioned earlier, is that when I transitioned from medicine, it wasn't the big companies that knew me. It was independent distributors. It was the nurse aunt of my first boss. It was my former rep who became my regional manager, now distributor. Those are the people that know you as Ben, and they know you as Chris. And then you tack on your title. That's fine, but that's not. I used to joke, I'm only Dr. Carr when I'm at work. I'm Ben the rest of the time. And what was really funny for me and is that my children never saw me really as a resident, never really saw me as a young attending, so that I was just dad.
Right.
I never forget my son was about 3, 4 years old, and he was taking swimming lessons, and I was dictating by the side of the pool, and his swim instructor said, "What does your dad do?" And he goes, "My dad fixed baxes." So those are the things that you remember, right?
Sure. That's a great story.
Yeah.
I like that. So, to kind of transition here a little bit, uh, Fairwinds Medical, I have found to be a wonderful company because it's big enough to get things done, but it's also small enough that you can have an impact on the direction of what you're doing. It's not like steering the Titanic. If you have something that you think needs to change or give an opinion on, they can listen to you and they do make changes. And I find that to be a wonderful thing about Fairwinds Medical, in that you can, as a surgeon, as a distributor, you can have an impact on the direction that you're taking.
I think you've hit the nail on the head. I think that the leadership, whether you're talking about Mr. Rob Nathan, whether you're talking about Mr. Michael Droge, whether you're talking about Mr. Bob Colby, whether you're talking about Mr. Norm Eckley, you have many people at a high level with vast years of experience in different settings that have a mission to provide and to streamline and to help new companies, people with new ideas, enter the health industry and to get their products to where they need to be. Basically the upscaling, the scaling of their services. To that end, I would like to give a special thanks to Mr. Paul Cruz, who I'd known for many years, back when I was a dreadlock wearing resident. If you can imagine this gray hair, black with dreadlocks, that was me, down to my shoulders. But Mr. Paul Cruz, who's always had a special place in my heart for the way that he has been able to sort of cut through the fat, trim the fat to get to the heart of the matter. He basically brought me into the fold with Fairwinds Medical. He told me the mission of Mr. Michael Droge and also Mr. Rob Nathan, as far as what they were trying to accomplish. They were no longer looking to just take from the medical system, but to help burgeoning entrepreneurs, burgeoning companies such as Plethy. I want to give a mention to Mr. Raja Sundaram with Plethy, a gentleman who had a past much like mine outside of the medical industry, and had a vision for what he wanted to provide for patients like his parents. How could he help them? And so when you have a company like Plethy that's looking to add value to patients outside of the traditional physical therapy, outside of the traditional home exercise program, when you have a company like Fairwinds Medical that is able to push Plethy forward to move the needle, it was a no-brainer for me to want to be a part of it. And Paul Cruz said, "Hey, I don't know where we're going to be a year from now, because we're very different than we were a year before, but I think I would like to have you with me." I said, "Put me in, coach." And so it's been a beautiful relationship.
Yeah, absolutely. It's a tremendous organization to be a part of and to work with. And as we were talking about, you actually have input into what they're doing, what direction they're taking. So the Plethy has a product called Recoup. So how do you present that to your fellow surgeons and bring it into the OR and into their practice?
Sure. I appreciate you allow me to discuss Plethi Recoup. It's RECUPE. Basically, it's what we call remote patient monitoring, RPM. You basically have a wearable device. I mean, who doesn't have an iPhone watch? Who doesn't have a Fitbit? But what it allows you to do is for the patient, for their physicians, to do home exercise programs directed by the physician, pre-surgical, post-surgical. Basically, it can become basically a standard of care for monitoring their progress. And so, what that allows is, not everybody, as myself, I live in Metro Baltimore, Maryland. I'm within 15 minutes of three major medical systems: Johns Hopkins, University of Maryland, Union Memorial. If I extend it a little further in the, as we say, DMV or the DC, Northern Virginia area, you get into Georgetown and George Washington, and you get into Inova system. So you have major players easily within an hour, but not everyone has that luxury. And so one of the beautiful things about Plethi Recoup, and I think this is where Fairwind saw the vision of the founders, is that you can bring excellent medical care to whatever situation you're in. We all know we've now 5+ years past COVID. Times are different. You can't always get into the office. Financial limitations can also play a role too, where people may not have the means, whether it be transportation, whether it be the actual finances to get to therapy. It allows their provider and the provider, physician extenders as well, to monitor their progress, to intervene and to interdict, to avoid complications. And so it's really, as you mentioned earlier, being able to be with Fairwinds Medical when they're providing an opportunity for Plethi to be visualized, to reach the people that need them, has been a beautiful experience. And so, to your point, what you said earlier, the way that I approach it is would this be a product that I would use? Would this be a product I would want to share with my buddy Chris? The answer is I don't use things. I never recommended things that I didn't believe in, because, as you know, it's hard to get in front of your patients and be a snake oil salesman. And so
Got to have credibility.
you have to have credibility. And I think, and I'm sure you've been there, would you use this? And so when I've presented this to many of the physicians that I work with or I interact with, the first thing I say is, this is a no-brainer for me that I would use it if I was still in practice. There's really no downside to this, only upside.
100%. And you're in a much more urban area than I am. In North Texas, it's much more rural. The ability to have that with the patient so that I can monitor their progress. And if something's going wrong, I can see it and intervene to hopefully get a better outcome for them, rather than waiting 3 or 4 weeks till their next office visit and then something has gone way south. And then, now we've got an obstacle. So one of the biggest benefits to me in a rural setting is I can monitor what's going on with my patients and see where they are all the time, which is a huge plus. So kind of in closing here, I want to ask you about something I found really, really special. You created an independent LLC named after your grandmothers. Tell me a little bit about that.
Thank you. I appreciate that. So my LLC is called Vera, VERA, Minnie, MINNIE, Medical LLC. Vera is my paternal grandmother, and Minnie was, should I say, both of them have passed. Minnie was my maternal grandmother. And certainly, they say, we get where we are off the backs of the hard work of others. I mentioned earlier that I come from a very close-knit family. The support of both my mother and father has been immense. I come from a family of, I had 3 siblings who've all achieved many things. I have a sister who is a very, high-powered lawyer. I have a brother who is a associate professor at Johns Hopkins in neurosciences, and I have another brother who unfortunately passed away, who was double mastered and all that stuff. So as I joke with people, I was the oldest, but actually probably the dumbest of
Uh,
all four.
yeah, not by that, but
Yeah,
okay.
but that's what I joke. I always tell a story. My sister, who's 5 years behind me, she said, "I'm just so you know, I'm going to a better college than you went to." I was like, "Well, I hope you do." But all that being said, my grandmothers, both of them were essentially domestics. Both of them supported to a large extent both of their families. My paternal grandmother in Providence, Rhode Island, where I grew up, and my maternal grandmother in St. Louis. And so certainly both sides of my family had matriarchs that were amazing. And so when I, started my latest LLC, the newest venture, it's very important to me that I acknowledge what both of those women not just to me, who I was close to with both of them, but what they meant for both sides of my family. And so it's a pleasure to have that name every time I, have to file or have to list something. And I think it's really a testament because I'm sure, as I'm sure you can attest, you aren't where you are without your family. I'm sure there were many people that helped you get where you are. And I've been very blessed. I have extended family cousins and aunts and uncles who, without them, there certainly would have not been a Dr. Carr. And
Sure.
certainly, even more importantly, and this is the part for my children, and my hopefully, knock on wood, my grandchildren, if I'm fortunate enough to have them, that they'll know that dad or grandpa didn't get through his challenges on his own, because I didn't. It was the others.
To summarize this from the standpoint of, I mean, fellowship trained spine surgeon Ben Carr, me, orthopedic surgeon, we got to where we are standing on the shoulders of giants.
That's it. Unrecognized giants in many cases.
Yep, absolutely.
Yeah.
Dr. Carr, I appreciate your time. I appreciate your expertise. You have a terrific story, and Fairwinds Medical is lucky to have you.
Well, thank you, Dr. Leslie, Chris, as you said, and Ben. It's really been a pleasure, and I really, if I had one parting statement, it would be for all those out there that we all go through our individual challenges, our collective challenges, and just know that, as long as you keep swimming, the sun will come up tomorrow, and I just hope that everyone can continue to get through their challenges and move their way forward.
Very well said. I appreciate it. I agree. And again, I thank you for your time, your expertise. And again, Fairwinds Medical is lucky to have you.
Happy to be
So
with them. Thank you very
thanks,
much.
Ben.